Hello, welcome. I'm Jacqueline Luongo, Director of Sales and Business Development for PDO Max. I'm excited about this vlog today. I have Sarah here with me, and we've worked together on a few different projects and a recent Take It to the Max webinar as well. So, welcome, Sarah. I'm really excited to have you and even be in this more relaxed setting for us to have a conversation and, give the audience some great info about smooth threads, multi-threads, and cyclones. Welcome. Tell us a little bit
Hey,
about yourself for those that don't know you yet.
yeah. So my name is Sarah McPartlin. I'm a board certified physician assistant. I have been working in the aesthetic industry full time for a little over or probably 4-ish years now, almost 5. So I started out working in urgent care and then moved to wound care. Kind of always wanted to be in the derm plastics field and kind of found my love for aesthetic medicine. We also do training. So I work at Beautiphi, which is in Rochester Hills, Michigan. So we train on novice and advanced injecting, and we also do thread training. So yeah, I love doing these kind of
Excellent.
things with you, Jacqueline.
Same. And, there's been almost now 6 months worth of these smooth trainings that you're doing with cyclones, smooth threads, and multi threads. And I thought this would be an appropriate vlog to do to talk with the audience about those that might be hesitant about the barbed threads, and we're going to get into that and why this is a really great way to start. And it's a great stepping stone into threads and the amazing results that you can get with it, along with answering questions about treatment protocols and combination treatments.
Mhm.
So I'm excited for you to review all of that. But what I think is the most, interesting to start with is you told me a story about a patient that came in that was there and booked for a lip filler, and you thought that they may be a better candidate for thread. So tell us about this patient.
Yeah. So we work great at Beautify together. So we collaborate on probably, I would say, almost every single patient. So we all have our own little niche that we do. So Kelly Hermans, who is my boss and owner of Beautify, she had this patient and she came in for lip filler. And we kind of took a look at her, and that's just not what she needed. She had lip filler the last time was probably around 2 years ago. And she had a smaller mouth, I would say, and she still had a little bit of volume in there. But when she smiled and she animated, she was puckering a lot. She had these lip lines, or people call them smokers lines, and she was tucking under a little bit. So we thought she was the type of person that was a great candidate for bringing in a multi-modality approach, which we do all the time, right? So she still had a little bit of volume from filler, and we're like, we don't want to push it with that. So we thought, well, if she's puckering and she's tucking under, we should use some threads. So we use cyclones into her upper vermilion border to give her that structure and kind of evert her lip a little bit, and it looks beautiful. And then we added some smooth threads going across her upper lip to help when she puckers, and it looked awesome. We also did a little bit of a lip flip to kind of keep it up, but she was one of those people that you're like, not everyone needs lip filler all the time. There's all these different avenues that you can go through, right? Depending on each person's anatomy. And it was interesting. We did threads, tox, and we did the tiniest hydration of lip filler on her bottom lip just to kind of tie it all together. But I, yeah, these are like a lot of my patients where it's just multiple things at one time.
And it's really great that you have that collaboration with everyone in your office, and we always encourage that, certainly, and to be able to pivot a little bit in that case. I saw the before and afters, and we are doing a practitioner spotlight on your work and this experience that, you are starting to have with these patients that are
Yeah.
coming in for certain treatments, and you're shifting and maybe doing more threads potentially. And of course, at PDMX, we love to see that,
Hmm.
and love to see that collaboration too. So that brings me to the combo treatments, these different modalities that you're doing with threads, and that it doesn't necessarily have to be black and white or either or. I love that you're getting creative, and if you want to share a few examples of that, I think it's really encouraging for practices to hear what you're doing.
Yeah, absolutely. So I hate using this term trial and error because I hate the term error, but I think a lot of things in aesthetics in general is trialing things over and over, and it comes with experience and realizing, okay, well, I've seen this type of patient population on someone else and realized, well, I did A, B, and C, and I didn't get the best result out of it that I think I possibly could get. So some examples I've had of people, great ones are necks as well as smile lines, radial cheek lines, and crow's feet. My favorite before and afters with threads have to do with crow's feet. So I would say I have multiple people, and I'm sure people can resonate with this as well in their practice, is once we kind of reach a certain age and we have that collagen loss, and we have people coming over and over and over saying, I need more crow's feet tox. I need more, I need more, I need more. And you're like, how much more can I put in? It's not your muscle, right? So you do your tox and you realize, okay, well, we kind of worked with that muscle and you still have those lines when you smile. And then you kind of look at their, all together, look at their skin integrity, and do they require biostimulator? Do they require cheek filler? Do they have that, loss of elasticity and need that collagen or true volume loss? And then I do, a biostimulator and I do filler, and I kind of always do a full face approach, and they still have that a little bit. And then I'm like, okay, well, this is more of a skin issue. So let's bring in lasers, let's bring in threads. So at that point, it's usually I do it kind of all together now at this point, but I'll go back in and I do some very superficial smooth threads, and I just cross hatch all the way across here, all the way down. And I bring them all the way around to those like smile lines here. And the before and after is stunning. But I didn't know that when I was first starting out, right? You kind of are trialing all these different options and you realize there's something more that we need. And threads are those, that cherry on top for a lot of procedures that we do day to day.
Love to hear that. And, I know Kelly talks a lot and she's been on a webinar as well, and how she really topped some of these treatments off even with Afterglow. And now, the practice is starting to get into Lumenvi more. So you
Yeah.
speak about the skin integrity. That makes so much sense. And why we have these different layers of how you can address those concerns.
Yeah.
And having these topical serums is just kind of like the cherry on top. That's the best way that
Oh,
I can
absolutely.
explain it from an aesthetic point of view, which is wonderful that you have all of those tools.
Yeah. Well, I'll throw in some smooth threads and then on top you do the PDO afterglow, and it's beautiful. It's a wonderful result.
Absolutely. So I definitely encourage anyone that is hearing this vlog to read up on the spotlight that we do on Sarah, as well as be able to access some of those before and afters because they are quite impressive. Another, yes, another question that comes up a lot, and we've talked about best practices and whatnot over the years and on webinars. Do you do a boost? Tell us a little bit about your process and when you've, treated patients with thread specifically.
Yeah. So again, I know everyone hates this answer, but it really depends on the patient, right? Depends on their skin and their age, where they're kind of at in their aesthetic journey. But we're very good and consistent with seeing our patients every 3 to 4 months, regardless, right? Most people are getting tox as it is. So I'm always making a note in their chart of things that we have done. And then I will come back and see them at 3 to 4 months and kind of keep an update and look and see before and afters and how you're doing. But most people, I do treat them with, in regards to like smooth threads, every 6 months. That's kind of my, yeah, kind of top them off a little bit at 6.
Certainly. And, from that 3-month period, that's an awesome time to take your second after picture to just keep that content up as
Right.
well. And, maybe even do a bit of that afterglow
Mhm.
microneedling or even just skin boost in that sense, which I'm sure that's, what that process is when you're incorporating afterglow and the PDR and Lumenvi into the practice.
Yes.
It's awesome. So, lastly, and I think most importantly, is to talk about the practitioner that has not used threads at all, and you're starting from the beginning, and hesitant about the more barbed threads, the more advanced threads.
Right.
Tell us a little bit about where this is a great stepping stone and you don't have to, and your training doesn't include that part of it,
Correct.
that you really are getting great results and you can gain some good momentum with cyclones, multi threads, and smooth threads. So tell us about
Absolutely.
that journey and where we're seeing great feedback and great flow and growth just within those three categories. And
Mhm.
eventually down the road, we are getting calls, Sarah, to have that more private training to get to that next level with maybe some of those barbed threads. But people
Right.
are starting out this way and very, very happy as they gain momentum and clinical confidence.
Yeah, absolutely. I think the biggest thing that you said is confidence is,
Mhm.
these, yes, they're both threads, but they're very, very different. They're doing completely different things. One with the barb, you're quote unquote, lifting. And when you're using the smooth threads, you're going in and you're creating that collagen and elastin kind of reproduction there. You're still doing the same thing with barbed, but you feel a lot more confident when you go in and you know that you're going very superficial and you're treating these little tiny fine lines here and there, and it really is it really is easy. A lot of people are very scared of them because they think of threads and they see stuff in the media. And these little tiny threads are so, so, so small, right? Over time, they are breaking down. And if you're placing them, correctly, and it takes, just a couple times of trialing it and you got it. I mean, our trainings that we do, people, once they, put in their third or fourth one, they're good to go, honestly. So I would not be scared of it. I would just know and kind of verse yourself really well with doing smooth threads and cyclone and multi-thread and kind of get that down and find your patient population that's going to work best for them. And then when you're ready, and if you have that population that wants to go and do barbed, sure, then jump into that. But it really is a whole different ball game, and I don't think people should be scared of it. I think us as injectors need to be very, very versed on safety and the risks of things and our anatomy ins and outs. So we use ultrasound and we do it with guidance, and we're putting in barbed threads. And we were taught that from our one of our great colleagues who's wonderful with ultrasound, and we developed that sense of confidence and safety, and now we can do that. But starting out, that wasn't our first thing, and a lot of our patient population is going to be more of helping that skin integrity. So no, don't be scared. Read up on it, understand it, understand the ins and outs, know exactly the plane you're going to be in, and if you know what you're doing, you don't have to be scared. Being educated is the best thing that you can do, right? If you don't know what you're doing, don't do it.
Right. And again, it is another tool in the toolbox with
Exactly.
getting proper training. The other piece that I love about, your training specifically is everybody is also working on each other. So not only are you doing, you're also experiencing, which is always so helpful in, that experience, so that you can talk about it down the road and also show the results.
Hey, it's the best way to get before and afters, which everyone wants.
Exactly, because you're there every day, for
Exactly.
sure.
Exactly. But
Uh,
yeah, I mean, I was when I first heard about threads, to be honest, I was a little like, oh, I don't know, because that's not something that I was really well educated on and taught about. And there's not a lot of people that do them, right? So when it's
mhm.
kind of that unknown territory, we're a little like, ooh, we don't know what to do here. But trial and trial and trial and educate yourself. And it's another tool that you'll be very happy that you have. I think it makes people nervous because it's very different from just our toxin filler that people, most people do day in and day out. And you have to learn a whole different way when you're doing these things, especially when it comes to barbed. But don't let that scare you. It's fun. It's super interesting. PDO has great resources and has great training. So I mean, go for it. But as long as you're, well versed, why not?
Great insight, and I appreciate that, and you sharing your experiences and, your journey and the
Yeah.
trials that you've gone through to get here and continue to kind of craft that art and perfect it as we go along for each patient. So thank you. Thank you for your time. I hope everyone reads your spotlight because I love it and it's so impressive and the photos as well. And maybe we'll see you again soon on a Take It to the Max webinar. So thank you,
Yeah,
Sarah. I
I hope so.
appreciate you.
Of course.
All
Always good
right.
to see you, Jacqueline.
All right. Thank
Right.
you.
Yep. Bye.
Bye. Hold on.